Hi, I'm Dawn Morse, the founder of Core Elements Training, and this is Katie Campbell, one of the tutors on our manual therapy CPD short course. In this short video, we're going to demonstrate mobilisation techniques for the ankle joint. I'm going to show dorsiflexion, anteroposterior, posterior to anterior, and caudad movements. So we start with the client in prone. We're going to flex the knee to about 90 degrees. For dorsiflexion, I'm going to use the web of your hand underneath the calcaneus, and then the other hand is going to be positioned like this. So here we're going to push down dorsiflexion, but also we're lifting up with this hand. So there's like two movements that you're going to perform. So we're lifting up with my left and then down with my right. So it's like that movement. So really trying to move the whole foot. So the web of your hand, bottom of their calcaneus, or top of their calcaneus, hooked underneath where the Achilles attaches there. Hand around the foot, and we're pushing down and lifting up. So we're lifting the calcaneus towards the ceiling, and we're pushing the forefoot and the midfoot towards the floor or to the couch. And this will be oscillation. 3 times 60 or 3 times 30 or 3 times a minute, depending on how your client responds to the movements. So if you'd like to perform a grade 2 or 3, they're easy to show because they're larger oscillations. We've got 2, not near the end of range, and then 3, a little bit deeper as we feel that sponginess or springiness in the end of range at grade 3. And then grade 4 is a smaller oscillation, and here we're in the end of range. So different grades, hand positioning is all the same, just depends how much movement you have and when the client's symptoms reappear. So remember, grade 1 and grade 2 reduce pain, grade 3 and 4 is to reduce, to increase range of movement. Your assessment movement first. So move into dorsiflexion and ask the client how that felt. Was that okay? Perfect. So as my client hasn't got a sore or stiff ankle, that felt okay. So that was dorsiflexion. And we've got the 2 movements. We've got the calcaneus moving towards the ceiling, and then the midfoot and forefoot moving towards the couch. Anteroposterior movement, just bend the leg again. So moving from the front to the back. Hand position is similar to the last movement. Web of the hand here supporting the tibia. Pop the foot in neutral. Cup the calcaneus. You want the heel of your hand just in the arch, just at the front of the calcaneus there. Grip here. And then we're going to have your elbows up nice and high because you're basically trying to slide the calcaneus or the foot backwards in relation to the tibia. So it would look like this. So elbows up nice and high. So you're supporting with the left, and this is the right hand that's doing the movement. So we're moving from the anterior to the posterior, using the calcaneus or the arch to allow us to move posteriorly. I've got a nice wide base. It wouldn't work so well if I was here and trying to move. It's not as effective. It feels like I'm just going to slide off. So make sure you're nice and low. You can move the couch up high if you've got electric or hydraulic. If not, a nice wide squat. Elbows up nice and high. Moving from the anterior to the posterior. This is working mainly on the subtalar joint. And we're going to stay with the subtalar joint when we perform the PAs, or posterior to anterior. Here we're going to cup around the front of the talus and the calcaneus, and now we're going to move from the posterior to the anterior. Calcaneus here, elbows are still nice and high, and then you're going to glide the foot forwards. So this is PA. So the right hand's just supporting, and it's my left hand that's performing the movement.
So these two are accessory movements. Dorsiflexion is a physiological movement. The AP and the PAs are accessory. The accessory can often help with the physiological movement. Now I'm going to demonstrate caudad. So caudad means a movement towards the foot. Cephalad is a movement towards the head. So if we were going to compress the ankle joint by pushing towards the couch, that would be a cephalad movement. A caudad movement opens the joint and it's a movement towards the foot. So using the web of our hand again, just in front of the talus and underneath the calcaneus, we're going to clasp our hands together. Ankle is over the knee, elbows out to the side again, and we just literally lift the leg using the ankle. The client should stay relaxed. I paused there because it felt like it helped again. The client may want to help. These should all be done passively. Mobilisations should be passive. So if the client does insist on lifting the leg or helping you, just drop the leg back to the ground and just ask the client to relax. You can even use some breathing techniques as well to help, or maybe just use a different mobilisation. Maybe it's too painful or they're just protecting that joint. So for the caudad longitudinal movement, we oscillate. So using the web of our hand on the foot, lifting the foot up, and naturally we have gravity and the weight of the leg helps the joint open. So longitudinal, you're just going to oscillate towards the ceiling, and you can pick your grades 1, 2 and 3. Grade 1, the leg will probably stay on the couch and you'll just be very gently lifting. You're always working with the client's pain. So if this was too painful, then you would apply less pressure. You would lift the leg up less. Grade 4, you could lift the knee off the couch and then oscillate because you're in the end of range. Elbows out. Hands should be nice and comfortable. If you were like this, there's a lot of movement, there's a lot of rotation. So remember, we want to try and isolate that joint and that movement as much as possible. So caudad, movement towards the foot, clasp the hands, use the web of your hands over under the calcaneus, or top of the calcaneus, and again in front of the talus. And again, because there is bony prominences around the ankle, if it is sore, just check it isn't your hand positioning. It may be the soft tissue on the top of the ankle. It's quite sore, especially if you work on the ankle because they've had an ankle sprain. The soft tissue around the lateral ligaments, they're going to be sore, potentially swollen as well. So we've covered dorsiflexion, anteroposterior, posterior to anterior, and the caudad movements around the ankle joint. These are all techniques that we cover in our manual therapy short course. If you'd like to find out more, please visit www.coreelements.uk.com. Don't forget to subscribe. Thank you.